two past CEOs. Just in taking a look at it before coming out here, I looked at some of the topics. So he blogs about things like the healthcare correlate of Toyota's approach to problem solving. He blogs about sometimes the best care we can offer consists in getting a patient home as quickly as possible, particularly in end-of-life situations. And then he posted a letter of appreciation, reprinted with permission, from the daughter and other relatives of an elderly patient. He posted a response to two doctors who bemoaned the proliferation of VPs and other administrators in the hospital. And one of them that was my particular favorite, because I write about this a lot as a health journalism critic, he really bared his soul that the current knowledge about the relative benefits of laparoscopic versus open prostate surgery, suffice it to say, he wrote, there's not a clear winner, just so too in the case of regular laparoscopic surgery versus robot-assisted laparoscopic. So in the absence of clinical evidence that the robot is better, what's going on here, he wrote. Here you have it, folks, the problem facing every hospital, and especially every academic medical center. Do I, Paul Levy, spend over $1 million on a machine that has no proven incremental value for patients so that our doctors can become adept at using it and stay up to date, so that I can then spend more money marketing it, and so that I can protect profitable market share against similar moves by my competitors? Paul, how in the hell can it be worth it for you to find time to write about that kind of stuff?
Well, first of all, thanks for having me. Is somebody mouthing my words there, so it looks like I'm actually there talking? To the core of your question, how can I have time for doing this? That's kind of like asking someone, well, how do you have time to talk to people on the phone? Or how do you have time to talk to a reporter? If you're the CEO of a hospital, part of your job is to represent your institution and what it stands for in the broader community. And a blog is actually a relatively efficient way for doing that, because people can read it at their leisure, asynchronously. And it's a lot more effective than a newspaper where you have reporters and editors filtering what you're going to say. So I would turn the question around and say, well, why wouldn't you do it?
And before we move on, just give us a sense of some of the internal feedback you get at times like when you wrote about the robots, or times like when you posted the response to the docs complaining about VPs.
Well, we have a pretty open place at Beth Deaconess, so and I guess people are used to me also. So people kind of like it. They read it, and folks have gotten used to the idea that when they send me an email now on a particular topic, it might show up on the blog. And of course, I don't know how many of them are reading it, but it's certainly hundreds per day, and people kind of like it. They enjoy it. They also take some pleasure in the fact that we as an institution are very open about these things, and we will post things like our central line infection rate and what we're doing to improve quality and so on with actual real clinical data in real time, and that other hospitals in Boston seem to be afraid to do that.